Chapter 6. Going Home. How to care for your wound after it is treated with Dermabond Advanced Topical Skin Adhesive. Dermabond Advanced Adhesive is a sterile, liquid skin adhesive that holds wound edges together. The film will usually remain in place for 5 to 10 days, then naturally fall off your skin. The following will answer some of your questions and provide instructions for proper care for your wound while it is healing. Check wound appearance. Some swelling, redness, and pain are common with all wounds and will normally go away as the wound heals. If swelling, redness, or pain increases, or if the wound feels warm to touch, contact a doctor. Also contact a doctor if the wound edges reopen or separate. Caring for bandages. If your wound is bandaged, keep the bandage dry. When changing the dressing, do not place tape directly over Dermabond Advanced Adhesive because removing the tape later may also remove the film. Avoid topical medications. Do not apply liquid or ointment medications or any other product to your wound while the Dermabond Advanced Adhesive is in place. These may loosen the film before your wound is healed. Keep wound dry and protected. Apply a clean, dry bandage over the wound if necessary to protect it. You may occasionally and briefly wet your wound in the shower or bath. Do not soak or scrub your wound. Do not swim and avoid periods of heavy perspiration until the Dermabond Advanced Adhesive has naturally fallen off. After showering or bathing, gently blot your wound dry with a soft towel. If a protective dressing is being used, apply a fresh, dry bandage, keeping the tape off the Dermabond Advanced Adhesive. Protect your wound from injury until the skin has sufficient time to heal. Do not scratch, rub, or pick at Dermabond Advanced Adhesive. This may loosen the film before your wound is healed. Protect the wound from prolonged exposure to sunlight or tanning lamps while the film is in place. If you have any questions or concerns about this product, please consult your doctor. Possible complications and side effects of bariatric surgery. The first several of the complications listed below can occur with any operation. Deep vein thrombosis, DVT, a blood clot that usually occurs in the lower leg. What are the signs and symptoms? Cramping, swelling, pain, warmth, and/or redness in the calf or behind the knee. What should I do? Call the doctor. How do I prevent this from happening? Get up and get moving as soon as possible. Keep the compression boots on your legs while in bed or chair during your hospital stay. Do not smoke. If you smoke, you are at greater risk. All sleeve gastrectomy patients will be on Lovenox for 14 days post-op. Pulmonary embolus or emboli, blood clot that goes to the lungs. What are the signs and symptoms? Sudden shortness of breath or inability to breathe. Shoulder pain. What should I do? Call 911 or go to the nearest emergency room. How do I prevent this from happening? Get up and get moving as soon as possible. Keep the compression boots on your legs while in bed or chair during your hospital stay. Do not smoke. If you smoke, you are at greater risk. All sleeve gastrectomy patients will be on 14 days of Lovenox post-op in order to prevent mesenteric blood clots. Pneumonia. What are the signs and symptoms? Shortness of breath, cough, yellow or green mucus with the cough, chest pain, and fever. What should I do? Call the doctor. If shortness of breath is severe, go to the emergency room. How do I prevent this from happening? Get up and moving to expand your lungs. Use your incentive spirometer 10 times per hour while you are awake for 1 week after your operation. Infection. You may have some normal drainage from your incision. It may be pale yellow to pale pink. Infection would look different than that. What are the symptoms? Change in drainage appearance like thickening, green or yellow in color, and/or foul odor. Fever greater than 101 degrees. Increased pain, swelling, warmth, or redness around the incisions. What should I do? Call your doctor. Nausea and vomiting. If you are less than 10 days from your surgery date, call your surgeon. Otherwise, you should make sure you follow the 30-60-minute rule. Chew thoroughly. Eat slowly. Meal should last 20 minutes. Stop eating when full. If you are following all the rules, consider expanding the 30-60 rule to the 60-75. If symptoms improve, follow this new rule for 2 to 3 weeks, then return to the 30-60 rule. If symptoms do not improve, call the office for additional consultation. Small bowel obstruction. An obstruction or blockage caused by surgery connections, anastomosis, Roux-en-Y gastric bypass, and BPD. What are the symptoms? Abdominal pain that will not go away. Persistent vomiting or not being able to eat. No or greatly decreased bowel movements or having diarrhea only. What should I do? Call your doctor. If pain is unbearable, go to the emergency room. Dehydration. Not getting enough fluids. What are the symptoms? Dark or concentrated urine. Dizziness or weakness when you sit or stand up. Confusion. How can I prevent this? Drink 48 to 64 ounces of fluid every day. What should I do for dizziness? Change your position slowly. If you take medicine for high blood pressure, check with the doctor who ordered it. If symptoms worsen, call your doctor. Ulcers. You are at higher risk of forming ulcers along the new connections, anastomosis, or staple line. What are the symptoms? Abdominal pain or pain in the lower mid-chest area. Vomiting or vomiting blood. Black stools or bowel movements. How can I prevent this? Do not smoke or chew tobacco. Take your antacid medicine as prescribed by your doctor. Stay away from aspirin and NSAIDs, non-steroidal anti-inflammatory drugs. See list of medications to avoid. What should I do? Call your doctor. If you vomit blood, go to the emergency room. If you are more than a week after surgery and you have tarry black stool, call the surgeon's office. GERD. Gastroesophageal reflux disease. Risk of GERD may increase after sleeve gastrectomy, which could increase the risk of other medical problems. What are the symptoms? Heartburn. Difficulty swallowing. Chest pain. Bringing up food or sour liquid. Feeling like there is a lump in the throat. What should I do? See your weight management provider regularly if experiencing these symptoms. Leak. Fluid from the stomach or bowel leaks into the belly cavity at the new surgery connection sites, anastomosis, or along a staple line. What are the symptoms? Racing heart rate. Temperature greater than 101 degrees Fahrenheit. Difficulty breathing. Abdominal pain. Shoulder pain. Extreme urge to have a bowel movement but not being able to. Feeling of impending doom or anxiety. What should I do? Call 911. It is best to go to the emergency room at the hospital where you had your surgery. If that is not possible, go to the nearest emergency room. Check now for hospitals in your area that perform gastric bypass surgery. Stoma blockage. Food is blocking or gets stuck in the new opening from the pouch in the small bowel, primarily for Roux-en-Y gastric bypass. However, sleeve patients may experience similar symptoms and should follow the same instructions. What are the symptoms? The feeling of very bad indigestion. The feeling of something stuck in upper chest area. What should I do? Scenario 1. Stop eating. Take a sip of warm water. If you do not vomit, continue sipping on warm water every 20 minutes until the food passes or the feeling passes. Scenario 2. Stop eating. Take a sip of warm water. If you vomit, wait 20 minutes and sip warm water again. If you vomit again, call your doctor. If there is not vomit with the second sip, follow scenario 1. If you ever vomit twice, call the doctor. How can I prevent this? Eat slowly. Cut up your food into small pieces. Chew your food very well. Do not drink with your meals. Strictures. Sometimes the opening from the pouch or sleeve into the small bowel gets too small. What are the symptoms? Feels like food is stuck all the time or like really bad indigestion. This happens every time you eat. Frothing or foaming in mouth. Nausea and vomiting every time you eat. Only liquids can stay down. It is possible that nothing stays down. What should I do? Call your doctor. Gallbladder attack. Any rapid weight loss can cause gallstones leading to gallbladder problems, not BPD. What are the symptoms? Pain under the right side of your ribs. Pain moving around to your back. Nausea and vomiting, especially after eating. What should I do? Call your doctor. If the pain is unbearable, go to the emergency room. Dumping syndrome. Symptoms that are caused by eating foods higher in sugar or fats. What are the symptoms? Nausea, diarrhea and abdominal cramping, sweatiness, runny nose, rapid heart rate, feeling tired, and dizziness. What should I do? You will have to wait for symptoms to pass. Symptoms usually pass within 30 minutes. Stay away from foods high in sugar or high in fats. Change in bowel habits, sleeve and RNY. You may have less bowel movements than you did before the operation, causing constipation. Constipation is having difficulty making a bowel movement or having a hard, dry bowel movement, or when you go longer than usual between bowel movements. Symptoms of constipation include difficulty passing your bowel movement, pain, or bleeding during your bowel movement, a feeling that you did not finish having a bowel movement, bloating, and nausea. Constipation is common the first months after weight loss surgery. What causes this? You are eating less food. You are taking extra vitamins. You may not be drinking enough fluids. You may not be getting enough fiber. Narcotic pain medicine like the one you were given when you left the hospital can cause constipation. What should I do? Medical recommendations. Take Miralax for 3 days prior to your surgery. You will continue Miralax after surgery until you have a bowel movement. Miralax is not a stimulant laxative. It uses the water in your body to hydrate, soften, and eases the stool through the colon. Do not go more than 4 days without a bowel movement. If you have not had a bowel movement in 4 days, we work from the bottom up. Do the following. Glycerin suppository. You may use 2 times in 24 hours. If this does not work, Dulcolax suppository. You may use 2 times in 24 hours. If this does not work, warm water enema. Purchase a Fleet saline enema. Empty contents and fill with warm water. Follow the package instructions for administration. Once you have had a good bowel movement, take Miralax daily in the evening. If your bowel movements become too loose or too frequent, adjust the use of Miralax to every other day. Oral stimulant laxative. Do not start use until 2 weeks after your surgery. Your bowels need to heal. Stimulant laxatives can cause dependence and should not be used on a regular basis. Instead, they should only be used to resolve constipation. Examples: Bisacodil, Exalax, Correctol, Smooth Move Tea, etc. Stool softeners. May try a stool softener such as Colace once or twice per day. Dietary recommendations. Drink 4 ounces Plum Smart Light or light prune juice. Pureed diet. Include 1/4 cup pureed fruit per day or baby food. Prunes, plums, peaches, pears. Avoid bananas and applesauce if you are constipated. Soft diet. Include 1/4 cup fruit per day. Use canned or jarred in light syrup or fruit juice. Rinse off the syrup or fruit juice. Avoid bananas and applesauce. No raw fruit. Fiber. Add fiber to your diet if you had your operation more than 2 weeks before your symptoms. You can use over-the-counter gummies or powder. Limit to 5 grams per day. If using fiber, make sure you are drinking extra fluids. Fiber needs the fluids in order to form the bulk. Drink 48 to 64 ounces of fluid every day. Change in bowel habits, BPD. You may have more frequent and/or loose bowel movements than you did before the operation. You may have more foul-smelling stool or gas. What causes this? Bypassing a large portion of the small bowel decreases digestion and fluid reabsorption from the stool. Fat malabsorption plays a big part too. What should I do? Avoid higher fat food. Speak to your surgeon. Vitamin deficiencies. Due to the decreased amount of food you are eating and the decreased absorption of some vitamins and minerals, you are at risk of having low vitamin and/or mineral levels. What are the symptoms? Weakness or tiredness. Confusion. Tingling or pins and needles feeling in hands or feet. Any unusual changes from the normal. What else could happen? If left go too long, vitamin or mineral deficiencies can cause permanent damage. Bones can become weak. What should I do? Take your vitamins and minerals for life. Get your blood tests on a regular basis as ordered by your doctor. Call your doctor if you have symptoms so your blood can get checked. Hair thinning. When does this happen and why? Hair thinning usually occurs anywhere from 3 to 9 months after your operation. Hair loss should be temporary. It is caused by a sudden drop in the amount of calories and protein you are eating and the hormone changes caused by rapid weight loss. What should I do? You can shampoo with Neoxin. Take 1,000 milligrams of flaxseed oil daily. Make sure you are getting 60 to 80 grams of protein per day. Take your vitamins and minerals as ordered. Take no more than 600 micrograms biotin per day. Your bariatric multivitamin should be sufficient without adding extra. Too much biotin can alter lab results such as thyroid panel and cardiac enzymes. Take 500 to 550 milligrams L-lysine or keratin or collagen. Large folds of skin. It is possible that you will have sagging skin. How can I prevent this? Take your vitamins and minerals. Eat healthy. Drink 48 to 64 ounces of fluids every day. Exercise. You may not be able to prevent this. Age and genetics may determine how well your skin recovers. Will insurance cover the removal of excess skin? Insurance may cover this. If you get rashes or skin breakdown under the skin folds, take pictures and have your doctor write in your chart about these problems. If excess skin interferes with normal movement or causes back pain, have your doctor write in your chart about these problems. If you wait until you lost all your weight or at least 18 months to 2 years after your operation. Hormonal changes. Hormones are fat-loving. When you lose weight, the fat cells release hormones back into your blood. What could happen? Females may become more fertile. Menstrual cycles can become irregular, causing increased risk of pregnancy. You need to prevent pregnancy even if you struggled to get pregnant before you had your operation. It is recommended to not get pregnant for at least 2 years after surgery. Use 2 forms of birth control. One form of birth control needs to be a barrier type, such as a condom or diaphragm. Periods or menses could be heavier and longer. If you have already entered menopause, you may have several periods again. Back or hip pain. As you lose weight, you may walk or sit differently due to a change in your center of gravity. What can I do? Exercise to strengthen the muscles of your legs and back. Be aware of your posture. Be patient. This change will eventually stop as your weight loss slows down. St. Luke's Weight Management Patient Follow-Up Schedule after Bariatric Surgery. Day 0. Surgery and hospital discharge. Prior to first surgeon post-op appointment. Appointment with primary care physician. Day 10 or 11 after surgery date. First post-op visit with surgeon and dietitian. 5 weeks after surgery. Post-op class with dietitian. 3 months after surgery. Second post-op visit with physician assistant. Lab slip given. Advised to get lab draws before 6-month visit. 6 months after surgery. Third post-op visit with physician assistant. Lab slip given. Advised to get lab draws before 1-year annual visit. 9 months after surgery. 5:30 meeting before support group at all locations. See Chapter 9 in your manual. We will take an after photo if you like. 1 year after surgery. First annual visit with physician's assistant. Annually forever. Annual visits. Lab slips are given at the actual visit for all second annual and follow-up annual appointments. Lab should be drawn shortly after this visit. Lab slips will not be given in advance of the visits. Social workers and dietitians are available for follow-up when needed. Call the office to set up an appointment. My Reminders Bariatric Surgery. Do. Plan for discharge before coming to the hospital. If needed, determine who is going to help you at discharge. Purchase liquids, protein, and vitamins as outlined in sections 3 and 4 of this manual. Purchase measuring cups to measure portion size once you are eating food. Respond to surveys from our department. Schedule your first follow-up appointment with the surgeon. Continue to follow annually. Refer to the follow-up schedule after bariatric surgery on previous page for time intervals. Quit smoking if you have not already quit. Let your surgeon know if you need help. Get your lab work done when ordered by your surgeon. Come to support group monthly. Take your vitamins and minerals daily. Call the office or bariatric team with any questions. Keep in touch and let us know how you are doing. Join us on Facebook for questions, answers, announcements, and conversation. Search Facebook for St. Luke's Bariatric Patient Forum and request to join. Watch gum chewing. It can cause gas and can block your stoma if swallowed. Download our Baritastic app. Use program code 58531 to connect to our program. Exercise. It is vital for your success. Get a medical alert bracelet. See enclosed information. Take your measurements before surgery and monthly thereafter. Stay committed when you hit plateaus, periods when you do not lose weight. This is your body's normal response to rapid weight loss. You will get over the plateau if you follow the rules. Do not lift more than 5 pounds for the first week after surgery. Gobble food. Eat slowly. Talk while eating. You will get air in your pouch. Drink 30 minutes before, during, or 60 minutes after meals. Drink alcohol. You will have decreased tolerance, which may cause you to become intoxicated easily. Alcohol can cause dumping syndrome and can be dehydrating. Use straws for first 6 months. Drink carbonated beverages for at least 1 year. Take aspirin or NSAIDs, non-steroidal anti-inflammatory drugs. Refer to the medicine list. If you take aspirin for cardiac, heart reasons, speak with your surgeon about this. Smoke. Drive while taking prescription narcotic pain medicine.